Join me as we go down south in today's discussion with Candice Langford, sexual health physiotherapist. We will be chatting everything from sex, pelvic floor health, and yeast infections. Enjoy. Hello, Candice, and welcome to Timeless Talks. How are you doing today?
I'm very good. Thank you so much for having me.
Thank you so much for joining us, and I'm super excited to have this chat. Um, it's a topic that I've been very interested in since becoming a Pilates instructor, obviously, and after having kids and going through some pelvic floor issues myself, and I'm pretty sure I'm still in the middle of that. But let's just get straight into it. So, first thing I want to know from you is I think you should have, or your parents must have been pretty incredible. And like, where did your passion for like sexual health physiotherapy come from? Because I mean, you were probably raised in a house where you used vagina and penis and vulva and all of that quite regularly to be so interested in this direction.
Yeah, my parents are amazing. But no, I actually was raised in a Catholic household, and that was
Okay.
not the topic of conversation. We were quite concealed and conservative in and around these conversations. So if anything, I hope someone hears that and realizes that you can change your perspective if you are feeling like this is really taboo and really scary to approach. But essentially, it was how concealed these topics are that made me more and more curious. I'm a very curious
Okay.
person. So in university, my first degree was in marine biology and ecology. And in that degree, I was really interested in reproductive biology. And when I finished that one, I went into physiotherapy. And in physiotherapy, we did a pelvic health kind of section for a couple of weeks. And in that, it was taboo. It was awkward for people. My lecturer would say sphincter, and everyone would giggle in the back of the class because she would pronounce sphincter instead of sphincter. And it was just like this taboo, awkward thing that we were now learning about. And that made me curious and made me dig in deeper. So the moment I left university, that was the first kind of area that I really wanted to explore that much more. We were told, oh, the FIJ is really complex. That's courses you have to do afterwards in order to learn more. They taught us a lot, but it was kind of like, oh, you have to open that door later. And it's all of that pelvic kind of all the concealed information made me that much more curious, made me want to dig a little bit deeper. So essentially, I left university, went and did a little bit more in the field of pelvic health, and I kind of just went from one taboo to the next. So, pelvic health is considered quite a taboo topic. It wasn't that widely practiced in South Africa at the time. And then from that, I went into the sexual health world, which was even more taboo. And I kind of like just dug deeper into this journey of being a pelvic and then kind of pelvic health physiotherapist, and then also really digging deeper into the world of sexual health and sexual dysfunction.
Oh, I love that. And tell me, who can benefit from your line of work?
Well, essentially, everyone has got a pelvis, so anyone and everyone could
even
benefit.
Men.
Yes, everyone, even men.
So
yes.
Men have a pelvis, I know that, but they can benefit from like pelvic floor physiotherapy.
Yes, 100%. So you have pediatric pelvic floor physiotherapists, you have pelvic physiotherapists that really focus on pregnancy and postpartum. You have individuals like me that really focus on pelvic pain, bladder pain, sexual pain within their population. And you have pelvic health physios that really focus on men's health too. So, everyone has a pelvis. Your pelvis is involved in all bodily functions, urination, defecation, sexual function, arousal, etc. And also in your functional abilities, getting up off the floor, your hip function, your lower back, etc. It's everyone uses their pelvis on a day-to-day for activities of daily living, and then also like pleasures and etc. So just like any other group of muscles, like your shoulder, for example, things can go wrong. You can get strains, you can get pain, you can get cramps, you can get injuries. And the same thing can happen in and around the pelvis. And in those instances, you would lean on the knowledge of a physiotherapist that has trained further in that field. So I'll just go through one example from kind of each population. So a child might have nighttime bedwetting, or they might have stool leaks during the day. And that might be a constipation issue that is resulting in stool leaks, or it might be resulting in urination and incontinence in that child. And then you could go to a pelvic health, a pediatric physio for that. Or it might be an individual in their reproductive years and they're struggling with sexual pain, so penetrative pain. It might be urinary incontinence, it might be prolapse, and a number of things. In the older population, as we reach that perimenopausal phase, individuals might be struggling with GSM symptoms, which is genitourinary syndrome of menopause, or symptoms of menopause, and that can really vary, and someone would be able to assess that. And in the men's health population, just an example, it might be urinary incontinence after a prostatectomy, or it might be pelvic pain because the pelvic floor muscles are incredibly tight, and that can present as a prostatitis, but it's actually more likely just tension around those perineal muscles. And once you manage to resolve that, then a lot of that perineal pain subsides too. So everyone's got a pelvis.
Oh, wow. Yes, that's true. Everyone has a pelvis, and I know there's a big difference between the male and the female pelvis. And the thing, I think that the misconception is we tend to, especially me, I mean, up until I did the Pilates training, I was like, okay, that's the only time I focused on the pelvis. And it's like, in the moment I felt pregnant, it was even more focus on the pelvis. And so it's that misconception of, okay, only women can have pelvis like problems.
Yeah.
Which I didn't even know about the kids, to be honest with you. And it's true, they have pelvis, and it's possible for them to have issues as well.
Yeah.
So what are some common misconceptions about pelvic floor health that you encounter in your practice?
There's loads, considering that it is a taboo area, so people really struggle to talk about the pelvis and the pelvic floor. But as a pelvic health physiotherapist, one of the misconceptions with coming to a physio such as myself is that, oh, you come here and someone's just going to massage the area, and then you're going to walk out and just have a bunch of Kegel exercises as your homework, and that's it. But, you know, it's so much more than that. There are so many different methods of intervention that we can apply to an individual's unique circumstance. So it's not just about like massaging the pelvic area, and it's not just about walking with a bunch of Kegel exercises. And then other really common misconceptions is, you know, that a little bit of leaking here and there is normal and it's okay, and it doesn't need to be addressed. It does, and it can be addressed quite quickly. So most of my incontinence patients, you know, will have 2, maybe 3 sessions, and significant amount of their, even after 1 session, significant amount of incontinence issues are resolved. And then it's just about fine tuning that person's activities of daily living. So there are solutions and there are treatments for what we, unfortunately, many of us kind of perceive as a normal, you know, oh, you're a mom, oh, you've had a kid, oh, that's fine for you to have incontinence. And then another misconception would be that tension is good, you know, and like a tight vagina is a good vagina type of thing, right? No, that's not the case. If you walked around with all your muscles tight all the time, that's not necessarily functional. Our muscles need to be able to go from a nice strength control position to a nice lengthened position in order to be able to perform day-to-day functions. My arm has to be able to go from full contract to full relax in order for me to reach the computer screen, you know, whatever it is that I'm going through. And the pelvic floor is exactly the same. You need to have this control through your full range of motion in order to feel as though, I mean, in order to kind of reach those treatment goals or pelvic health goals, whatever it is that you might be working on. So it's not just about squeeze, and it's not just about like make it as tight as possible. You want full range of motion and control through that range.
What's the chances of this? Just popped into my head now. What's the chances of an over tight pelvic floor leading to a woman not dilating for birth? Can that play a role? Like,
so when people talk about like a really, really tight pelvic floor, they often think of patients with vaginismus. So vaginismus is tension and guarding in that pelvic floor, so much so that the individual isn't able to achieve penetration, right? So that's like one kind of side of the spectrum of having tension in the pelvic floor. Those individuals can still have a vaginal delivery. So I think that should answer your question. You know, tension doesn't make it so that you cannot have a vaginal delivery. There's a lot that can be done for these individuals in order to make them feel emotionally, mentally, physically more prepared for a vaginal delivery. And the same goes for anyone that does have tension in their pelvis and their pelvic region. So if that is anyone listening to this, I would definitely say if you feel like you've got too much tension, which can present as sexual pain, constipation, urinary incontinence, it can present as many different things, and you are planning on having a vaginal delivery, there are things that can be done to help an individual dilate that little bit more. Not, and I shouldn't even say dilate, because dilate is more about the actual cervix, which has got nothing to do with your muscles, but being able to have a vaginal delivery without, for example, like perineal tears, etc.
Okay. Now I was wondering, because I wasn't able to dilate. I was just stuck, and I was ready to squeeze that baby out, and the doctor's like, good luck trying, because there's nothing happening down there. I was wondering.
Yeah, so
no, that's interesting to know.
Yeah, the dilation that you're speaking of, it might have been that the cervix itself wasn't dilating, which is not necessarily got anything to do with what's happening in the pelvic floor muscles.
Okay.
Make sense?
Yes, makes sense.
Yeah.
Two completely different things.
Yes, exactly. One is part of the uterus, and the uterus contracting to push baby down and to get that softening and the distension and the dilation of the cervix, whereas the pelvic floor is kind of a layer after that.
Yes. Okay, perfect. And what are some signs and symptoms that someone might have a pelvic floor issue? When's the time to go? I need to go see Candice now.
So I think we've covered a couple of little things that might be kind of piquing people's attention, but one of the important things is that, you know, if you've got a little niggle, a lot of the time people think, oh, it's just a little niggle, it's just a leak every time I sneeze, and I don't sneeze often, so it's fine. If you've got a little niggle and you're ignoring that little niggle, that's not the thing to do, right? You need to manage those little niggles, because what can happen is that as you progress in age and you move into the post-menopausal time of life, then those little niggles can become a daily struggle. And it's not that it's too late. If that is you, it's not too late to manage those things, but you would rather get a hold of them earlier rather than later. So if there's little niggles, and those little niggles can be a number of things. So the little niggle might be a little bit of urinary incontinence. It might be when you stand up from the toilet and walk away from the toilet after a wee and you get like drip, drip, drip. It might be waking up multiple times at night in order to urinate. It might be the need of having to wear a pad every single day, just in case, or just to protect yourself. Have this fear of a potential leak. A number of other things, such as, like we've said, constipation. That's a big one. Constipation really has this overlap with a lot of other pelvic symptoms. So constipation, typically it is going to impact bladder symptoms. Constipation impacts prolapse symptoms. Constipation impacts sexual symptoms. So it's usually like one of the cornerstones of what we would work on in order to help to manage anything. So if constipation is there, that's like a big one. Make sure that you sort that out and get a hold of that, because that can have this knock-on effect of other symptoms that an individual is experiencing. And of course, always pain. Like penetration should not be painful. With a tampon, a finger, a speculum, a toy, a penis, whatever it is, it shouldn't be painful unless you want it to be painful. And that's a sign that someone needs to investigate whatever it is that you are experiencing, your pain, your symptoms, your discomfort. So that's a huge one that people often feel as though that, oh, I must just grit and bear with it. I'll never forget an Afrikaans patient. She had mentioned that she had been told, lay op jou rug en doen jou plig, which is kind of just, you know, lie on your back,
lie down and just take what you get, basically.
Exactly. And that was, in that instance, the individual was kind of being told, like, oh, push through the pain, like it's okay, like just do your duty. And that theme is something that I've heard time and time and time again. And it's kind of a message that's passed from generation to generation to generation, and it's not helpful. It's not helping anybody. And that is something that we really need to change that narrative, and we need to encourage these individuals to speak openly about these
Yes.
symptoms and seek help. Yeah.
And would you, especially women that went through cesareans, like motivate them to definitely go see a pelvic floor specialist and a physio? Like for
Oh, yeah.
me, I've had 3 cesareans and I can feel I need help, but
Yeah.
unfortunately, I don't think I have that here where I live. But if so, in my case, I can't get to a sexual health physiotherapist, will a normal physiotherapist be able to help you or not? Not necessarily.
You'll be surprised at how many people have got some kind of background insight in and around pelvic health. So I would definitely explore the your existing physios in the area. Sometimes people have done like one course, and they can at least advise you a little bit. Alternatively,
Okay.
there's so many physiotherapists that are online and offer virtual consults, and there's a
Oh,
lot,
wow.
especially pelvic health physio, because a lot of it is education based, and you
Okay.
can gain so much from virtual sessions. I'm very strong on making my patients kind of do self-treatment, because I want the control to be in your hands, not in mine. I don't want a patient to rely on me for symptom resolution. So what I'm trying to say by that is that you can be taught online self
Okay.
methods that you can start to learn to manage your symptoms. But just to cover the first part of your question, absolutely. Cesarean section, it doesn't save your pelvic floor, as sometimes kind of people are made to believe. It's still major abdominal surgery. If you had major surgery on your knee, you would go for physio, you would go for rehab, you'd go for prehab, just to manage that exact area, but also the muscles and the joints above and below. And the same thing goes for a cesarean section. You can have a lot of scar tissue, you can have a lot of adaptive behaviors, such as being in this flexed over position, not activating your abdominal wall, not activating your pelvic floor well because of tension, or because of pain, or because of a fear, because so the surgery is major, and it shouldn't be ignored as it's like, oh, it's just just another woman just giving birth and it's okay. No, it's still major abdominal surgery, and we should treat it as such. But also, a lot of symptoms are residual from the pregnancy itself. And whether you have a vaginal or cesarean section delivery, you were still pregnant, right? You
Yes,
still
at
carried
the
the
end of the
weight
day.
of a growing baby. You still had adaptive behaviors. You still, there might have been symptoms that you might have had constipation and a lot of pushing and hemorrhoids, etc., from the pregnancy itself. And that is something that can also be worked on in this postpartum period. So yeah, definitely
Okay.
vaginal. Everyone deserves to have a consult with pregnancy and
Yes.
postpartum.
No, I believe that. And it's sad that we're not being pushed almost. I would prefer, like, if my doctor forced me into physiotherapy after, I would have been like, okay, yay, thank you. But otherwise, you just go, I don't need it right now. Is it normal to get regular yeast infections after intercourse?
No. And I'm so glad you asked this question, because no. One, it may not be a yeast infection. Another thing is, people often say like, oh, I get a UTI after every time I have it might not be either of those things. It could be a number of other things. So number one, you might be allergic to the lubricant that you're using, and that might be the thing that needs to be changed because your tissue is reacting to that lubricant. Number two, it might be that you're not using lubricant and your tissue is reacting to friction, and that results in irritation. And if you can imagine that if I went onto a sensitive part of my body and I just did friction over time, you can get a bit of sensitivity, you can get thin tissue, you can get irritated tissue. The same thing can happen inside the vagina or at the entrance, at the introitus. So lubricant in itself might be a bad type of lube, or it might be that you're not using lube. Outside of that, it could be hormonal changes to that vestibular tissue, the tissue at the entrance of the vagina. It could be that tissue is impacted by an oral contraceptive. It could be an antihistamine that the person is taking regularly. It could be that the person is on some kind of estrogen blocker, or their estrogen levels might just be low, depending on the time of their cycle, or whether they're in perimenopause or postmenopause. All of those things can influence the tissue at the entrance of the vagina. And now if we go and add a funny lube, or like a lube with a scent, a smell, or glitter, or whatever in it, or we go and add a lot of friction to it, that tissue might be that much more vulnerable, and then result in itching, stinging, burning, discomfort, increase in vaginal discharge, in order to try, your body's trying to manage, like, oh my gosh, this is so, let me produce more vaginal discharge to manage with that. And then if there are any micro tears in that tissue, that then can predispose you to a pathogen or some kind of infection. And then, yes, you might end up going to the doctor, and the doctor's like, yes, there is an infection, and this keeps on happening. But it's not about them treating the infection, it's about treating the vulnerability.
The cause.
Yes.
Yes. Okay,
Yeah.
that's good to know. So there's
Yeah.
lots of causes, and it's scary to think that, like, our like, I'm on the Mirena, so that is a hormonal thing. Like, that's something we put into our bodies, like that can cause it.
No, so that is a different circumstance. So sometimes people that are taking an oral contraceptive, so
Okay, so only oral.
Yeah, yes. And in some people have a lot, their vestibular tissue is a lot more sensitive to the
Okay.
impact of a combined oral contraceptive. So that's like taking the pill, not the mini pill, the combined one. And it's the way that it's processed through your liver. It increases something called your sex hormone binding globulin, and that mops up your extra testosterone. So your testosterone levels go down, right? And the tissue at the entrance of the vagina is reliant on your testosterone levels. So sometimes if you are particularly sensitive, if you have got a lot of estrogen receptors at that site, then that change in your hormonal levels can make that tissue more vulnerable.
Okay, more sensitive almost.
Yes, it's not everybody, but if someone is getting persistent vestibular or vulvar pain and irritation and stinging and burning, and they are on an oral contraceptive, that is something that they can inquire with their provider and say, listen, since I started this, I feel like I've got constant thrush. It's not thrush, but it feels like constant thrush. And it's just stinging, burning, itching, sore, uncomfortable, sex is not painful, etc. Then that person might inquire with their provider and see if there's an alternative for them, because some people, not everyone, are much more sensitive to those changes.
Okay. So just be mindful of what you put into your body, basically. And I think we live in such a rushed world that it just goes over our head, and we just, like you said, it's just like, oh, I've got thrush again, or another yeast infection, or another UTI, which is crazy. So you're a fellow Pilates instructor. How beneficial have you found Pilates for pelvic health?
So positive and negative. So one of the negatives, and I'll just start with this because this is something that I've chatted to many Pilates instructors about, is it can negatively impact patients, especially pelvic pain patients, if there's just this focus on tension, pin down, tighten, grip, and if we do that with everything, and then when the patient walks away from the class and there's no cue to let go, to soften, to downtrain, to breathe, to, stretch out and just kind of turn off everything that we've just turned on, that can lead to dysfunction or more pain or more kind of cramping sensations in the pelvis. So that is a negative that I really try and get people to kind of shift in their practice, is to make sure that there's a good balance of turn on and turn off, and not always think about grip, pin down, tighten, etc., but rather get a bit of a combination. Then the positive, I'm sure people would probably anticipate that my answer is going to be like, it's about the core. The core is so great. No, it's my positive experience about this is more to do with proprioception, the person becoming more aware of their body and space, taking time to slow down, to breathe, and to focus on different areas of their body, how they move, the quality of movement. And I find that has this knock-on effect in other activities. So if that person went and then joined a CrossFit class, right, which is faster pace, go, 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 and just like get as much done as you can, that person ends up having that much more awareness of their body in space and control through movement, that then reduces the likelihood of them injuring themselves with these kind of faster pace movements that patients do. So I definitely feel like that breath, the control, the timing, the isolation is really valuable in other areas, with an addition of Pilates to their kind of exercise regime.
Well, I guess that's why the first principle of Pilates is awareness, for that reason.
Yes,
and
exactly.
It's funny, I mentioned to you that no, I didn't mention to you. I mentioned to you I had 3 cesareans. I had my 3rd cesarean was actually done to fix my retroverted uterus with a ventral suspension. So my doctor believed that the laparoscopic way isn't very successful all the time. So we just decided to go full on cesarean for the 3rd time. And I feel like since then, my Pilates practice has completely went downhill. I don't know if it's all those scar tissue that I've got that's built up after the 3. It's just so frustrating as a Pilates instructor to not have that control over my pelvic floor anymore. It's so annoying. And I'm sure I'm not the only one.
No, you definitely are not, because, you know, any surgical intervention can change the way we perceive our bodies, the way we move with our bodies. It can change our relationship with different areas of our bodies. And that might be something that's occurred with you. There might be a fear, there might be a worry, there might be, you know, an inhibition of certain muscle groups because of tension, because of scar tissue adhesions. And that's something that would be really helpful for you to chat to your pelvic health physiotherapist about, and really just determine, okay, are there things I'm not doing? Are there things that I'm avoiding? You know, has my breath changed? Is there scar tissue here? You know, are there other areas that are potentially having a knock-on effect on my pelvic region? You know, it can be a number of things, but it is very common for pelvic surgery or abdominal surgery, whether it is via like a cesarean section incision or if it is laparoscopically, it's really common for that to have this knock-on effect on pelvic function.
Okay.
And it's definitely worth you digging that little bit deeper and seeing if there are other approaches to care that
listening to your gut.
That's exactly it. Yeah, listening to that's one of those benefits from Pilates, right?
Quickly, before we run out of time, we've got 2 questions that follow a sentence. The one lady says she's got a 3B perineum tear and prolapse. Will she be able to do resistance training again?
Distance training?
Resistance.
Oh, resistance. Absolutely. Oh my goodness. Yes, absolutely. So one of the worst pieces of advice that a physiotherapist can ever give is to tell the person to just be on bed rest and just don't do anything, right? Because we know that exercise, movement, strength, endurance, that all has a significant impact on every single aspect of our lives. Sleep, our physiological health, our mental clarity, our ability to get up off of the floor, look after our children, etc. So this person is wondering, okay, can I do resistance training? Now, that person needs to think about their day to day. Do you have to lift up shopping? Do you have to lift up a child? Do you have to pick up and carry laundry? That's all resistance work. So
functional.
if you don't do resistance training to prepare yourself for normal activities of daily living, then you are putting yourself at risk, because you still have to do those activities of daily living. Those are not going to disappear because now there's a diagnosis. No, you would rather do the correct type of exercise resistance training to prepare you for functional activities, and that is going to be much more beneficial without fail, then someone saying to you, oh no, you've got this diagnosis, that means you cannot do resistance training. Nonsense. You would rather prepare your body and make it that more realistic. So absolutely, this person should 1000% be working with a pelvic health physiotherapist and start as soon as possible with progressions towards their exercise goals. You don't go, zero to hero from the beginning, but you definitely start working on making progress, and you do so with someone that really knows what they're talking about and is your advocate. Like, they're excited for you, and they guide you along that progression plan.
So whoever sent in that question, if your current physiotherapist is telling you to not do resistance, find another physiotherapist. Basically what we're telling you.
Unfortunately, yes, you shouldn't be advised to not move your body, because you have to move your body. You're going to have to lift up a heavy handbag. You'd rather be prepared to lift up that heavy bag and feel strong to do all of those normal activities you're living.
Can you reverse a pelvic floor prolapse?
Okay. So a little bit of nuance in this answer. So pelvic floor prolapse is graded. And what if there is a protruding prolapse? So that typically means that tissue is sitting outside of the vagina, outside of the entrance of the vagina. That is typically seen as this person might need surgical intervention, or they might need a pessary, as well as the adaptive physical behaviors and exercises with a physiotherapist. All right. So that person might need more intervention. But there are many things that might be exacerbating a prolapse. So your protrusion or that prolapse might only be sitting outside of the body and considered a grade 3 because you are heavily constipated, because you are consistently bearing down, because you don't have control of your intra-abdominal pressure. So if you were to be seen by a physio and they were to advise you on all these different things that we can do, you might find that a grade 3 is actually only a grade 2, but your day-to-day, the constipation, the pressure management, etc., might have been making that prolapse present as a grade 3. Okay, so lots that we can do to, I don't want to say reverse, but the appearance of a prolapse might be exacerbated by things like your constipation, pressure management, etc. So we can change your symptom presentation, but essentially a prolapse is not a pelvic muscle issue. It's a connective tissue issue. Okay. Your organs are slung up. They are held up in your pelvis by ligaments and connective tissue. Your pelvic floor is like a floor underneath that. So your pelvic floor can help, but it's not the thing that holds up your pelvic organs. It's contributing, but it's not the sole suspension unit. It's the things that are happening on top of those pelvic organs. They might be pushing them down constantly, or there might be a heavy full rectum with someone that's constipated, that's pulling it down because it's heavy. And if we can resolve the pressure management, and if we can resolve the heaviness in that bowel, for example, because that person is constipated, then we might just get those organs from sitting quite low to just sitting a little bit higher up. And then we go and we really make sure that floor is also underneath, just like really healthy, really strong, really doing what it can to help to support those pelvic organs. So a bit of nuance in the question. It takes a lot of education and like pictures and images and graphics for someone to really understand what's going on in their body. But definitely worth, if someone's got a prolapse, definitely see a pelvic health physio so that you can understand this a little bit more, and whether you do or do not have surgical intervention in your future. It might, surgery doesn't just like provide the quick fix, right? Surgeries
Yes.
have a really high recurrence rate, like 40 to 60%, where that person can have another prolapse, and that surgery can fail. So whether you are or you're not having a surgery, you want to make sure that you've managed the other stuff that can be exacerbating it. And because that can be the thing that leads to the recurrence after surgery.
Okay, perfect. And then your 3 timeless tips for everyone listening.
Okay, so let's think. Number one, if there's constipation, manage it. We've discussed that already in this talk. Number two would be to know your anatomy, get comfortable, get curious, know the names, know what it's called, what it looks like, do what it is that you need to get you to that point of feeling comfortable with your anatomy. And the third thing I would say would be, if there are symptoms, approach it like you would anything else. If you had a sore throat, you would go to the doctor, open your mouth out wide and be like, it's sore back there, you know, like, and show them and be like, you know, that's sore, and you would get it resolved. If your tooth was sore, you would go and get it resolved. Your pelvis, your pelvic floor, your sexual health, your bladder health, etc. We should have that same sense of urgency, and that you know, not have shame. We should not have shame associated with seeking help. And just, you know, if there's something there, ask questions, go seek help, go find the answers, go manage it just like you would any other area of your body. Yeah, and I mean that's 3 already. I could go on, but
I like those. Yeah, no, I like those 3. And then one last thing, I know you love the ocean. I know you love a sunset. If you can have a sunset beach stroll with anyone, dead or alive, who would it be and why?
Oh my goodness. I'm not really one to like
It can be your husband as well, by the way.
pedestal. Well, that's the first person I thought of.
So exactly.
I think it's him.
Oh, that's very sweet. That's very sweet. Okay, I love that. Thank you so much, Candice, for your time and all your knowledge. And just keep doing what you're doing on social media. You are helping so many people, including me. I love your stuff and all the information you throw at us. And hopefully we get to chat soon again.
Yes, I would love that. Thank you so much, Joe. Have a good day.
You too. Bye.